All right. Good afternoon, everyone. Good afternoon, Fresno County. Welcome to our follow-up, our MHSA Community Planning um, follow-up session. Uh, what would you call it? Meeting, a report back session that we are doing virtually still. Um, just wanted to make sure that we continue to communicate with our stakeholders and making sure that as we go through our MHSA 3-year planning process, that we have both transparency, but also an effort to where we have, ongoing and what would you say, bi-directional communication. So the follow-up sessions are not something that is required under the Mental Health Service Act or for the community planning process, but it's something that we found a couple of years ago to be really useful when we were doing the 3-year plan to have those community planning sessions, which we did do 4 of about a month or so ago. We did 2 in English, 1 in Spanish, and 1 in Hmong. And we said that we would report back to our stakeholders here um, before we start writing or completing our annual update, our MHSA annual update. So this is just a chance for us to share a little bit about what we heard, what are some decisions that we're making, and what you can anticipate and or see in the upcoming MHSA 3-year plan and annual update to the 3-year plan. And so this way, you'll have some opportunities to provide some input and feedback. You'll be able to what is the word I'm looking for? You'll have an idea of what is in the plan beforehand, and so it won't be during that 30-day review, or the public hearing won't be the first time that you'll hear about anything that we're doing with that. I do want to remind people. Sorry, trying to find the resource for you guys. So we do want to remind people where you can find a lot of information for all our activities related to MHSA is just by going to fresnomhsa.com. That will bring you to the department's MHSA page. And so you'll find information on there on some of the current plans, some of the annual updates, some additional information about MHSA. But there's also information on contacting us. So after today's meeting and the subsequent follow-up sessions between now and when we post a plan for 30 days, if you have an idea, a question, comment, we're going to ask you to submit those. You'll be able to submit some questions today in the chat during the live stream. But if it's after the live stream is completed, please use the email mhsa@fresnocountyca.gov to email us. We would love to be able to get your email or question. That way we have it in writing, and that way we can include it also in our annual update. And we will provide a response as quickly as possible on those, and those responses will also be included in the annual update. Our plan right now is to have the annual update completed and written by January, sometime in early to mid-January, so we can have the full 30-day public review and comment process, and then have a hearing at the end of that process, and hopefully have the plan approved by the end of January, with time to move forward. One of the reasons why we do want that plan approved sooner than later is that there, as you guys may know, if we're making changes to MHSA programming or planning, things have to be in the plan in order for us to be able to do them. So there's a couple of things that were brought up and I will get to here shortly, during our community planning process, that we had either provided some ideas for or had solicited some input on. And so those things are going to need to be in the plan before we'll have the ability to implement them or work on them or utilize some of those funding. That's really why getting this done quicker is important. I do want to provide a couple of just parameters or just some, what is the word I'm looking for? Context for some of the things that we're going to be doing with the annual update. So as you know, each year every 3 years, we do a MHSA 3-year plan with our robust community input process and getting stakeholders and just trying to really look at whatever all of our community needs and options. And then we, in each subsequent year, do what is called an annual update. So the annual update is 2 parts. It's being able to touch a little bit on what has been done in the past year, but it's really also focused on projecting what we're going to do in the upcoming year. And if we're making changes to the programs or additions or things like that, those would all outside of that 3-year process or cycle, they will be done as part of that annual update. And so that's why we want to make sure that everyone is aware of what's going on in there. For Fresno County, we are not going to be doing really much drastic changes with the annual update. And then there's a couple of reasons for that. With the exception of some of the things we're going to go over here in the report back session. As soon as this annual update is done and approved, which we hope to be, late winter, early spring, we'll only have a quarter left on this particular fiscal year for the plan, and next year will be the last year of our current MHSA 3-year plan. So this summer we'll begin working on developing a new 3 MHSA plan. So we don't want to make a lot of changes or try to do a lot of things midstream when we're going to have to come back and really do a robust community input and have conversations with all of our stakeholders and different communities to help shape and develop our new 3-year plan. So being that we have only about a year left, we didn't want to really utilize this time to try to develop new programs or new additions. And at the same time, we're also looking at what is financially and fiscally viable. So we also don't want to, we're just not in the position really right now to add a number of new programs or services or expand services. Well, there's a couple of things that we're going to need to do in order to do that. One is continuing to evaluate and assess our programs, really looking at where opportunities that we can maybe shift some of the funding in terms of how maybe some programs are funded. We're looking at where are ways and areas that we can improve on our federal funding participation match. So that's basically being able to bill Medi-Cal. We're hoping with the new inclusion of peer certification, and in the coming years, peers being able to build, that'll help offset some costs. And then we're also looking at what impacts California's payment reform will do in terms of maybe helping offset some costs with some programs and allowing us to utilize those MHSA for services that cannot be covered. So just with people, listening in or viewing today or watching later, there's a lot of things that we want to take into consideration. We did not want to make drastic changes to our plan at this time because we did want to have that be part of a larger, fuller process. And so we do want to make sure that I guess we understand that if we're talking about adding programs, if we're talking about expanding programs, we at the same time have to look at either how would we sustain or grow those existing ones, or potentially what changes we would have to make to our plan, including what programs are going to be ones that we're going to have to then shrink or reduce if we're trying to add something new. We do not want to do this arbitrarily, which is why the county continues to have these communications and why we also continue to try to do evaluations and assessments and really have our work be data informed. So we did have about a month ago 4 community planning sessions, like I mentioned at the beginning. We had 2 in English, 1 in the evening, 1 at lunchtime. We did have 1 in Hmong, and we did have 1 in Spanish. With one of our English ones, we had, I think, a fairly good kind of question and answer, and people were asking questions and providing some input, which was really helpful. And then in our Hmong community planning session forum, we did have a lot of participation and input and feedback from some of our monolingual Hmong speaking community, which was really excellent to have folks provide us with some really good insights and addressing some of their concerns and also needs. So those are all things that are being factored in. What I want to dive into here is a couple of things in terms of projects that we needed to get some community input on, and we did receive some community input on a part of it, and wanted to follow up with you guys and report back on that, and then also let you know how we're going to hopefully address that in order to include it in the plan. So for those of you that may have participated in our community plan process, or if you went back and watched later, if not, you can always go back and watch that before watching this one. The county did receive SNHP funding about $200,000 that was returned to the county, which was actually money that had been generated as a result of interest accrual. And the state did give that money back to the county and said that we needed to use it for some type of housing assistance for our housing programs. However, the catch was whatever we decide on how we're going to spend it needs to be in our plan, our MHSA plan, our annual update, and the monies have to be spent down by June 30th, 2022, so in about 6 months, or that money would be lost. So we did ask our community at that time in our community forums what might be some uses for those monies or what could be some suggestions. We shared some potential ideas, being that we are fortunate to where we're having more No Place Like Home and some other housing and support housing initiatives coming to fruition, that there could be utilization of some of those funds to support those projects as they come online. There was also some suggestions of looking at what could be maybe some training, working to support housing advocates, working individuals in housing or at risk of losing their housing that could be utilized to support them. So we took all of those input back, really met with our housing team. We reviewed the regulations. We even had to do some check-ins and calls with the state just to verify and make sure that we're understanding what our focus areas have to be and what we can and can't do and what does that entail. So for the housing funding, which like I said is one-time funding, a little over $200,000 that has to be spent down in about 6 months, cannot be incurred, has to actually be spent down. And so we looked at what were some things that were viable with those funds. One of the things was that also meets the criteria for housing assistance is deposits. So as people are moving into these new units that are being created, built, and established, there is still the cost for the move-in for their deposits, things of that sort. So we thought that this would be a great way to ensure that people are transitioning from being unhoused into permanent support housing by covering the cost of their deposits so that they can move in, that doesn't become a hindrance to them becoming permanently housed. So housing is one of the things that has been identified. Move costs or move-in costs. So that could be things from if they need assistance with getting their stuff out of storage, if they need help with getting utilities and some of those things turned on. If they need to make deposits for some of those things that maybe in order to get those turned on. Those would also be cost that would be done. So deposits and then moving costs. And then the third one that was proposed, and we did some checking to make sure is something that we could do, was developing what they're going to be calling or identifying as, welcome boxes, welcome packages. And those are things that could vary from things like hygiene and toiletries. It could be kitchen, household materials, cleaning materials, mops, brooms, pine sol, things that people can maintain and keep their new housing places clean, as well as some non-perishable items when it comes to food. So canned goods, maybe some dry goods, just so that it allows the person enough time until they're able to start grocery shopping, have their money that they need to be able to do those things. So these are things that we hope will support the transition of individuals from unhoused into housing, and at the same time, there are things that we believe we can spend on as soon as we have the plan approved and how people get in. We do have I don't say concern, but we do know that this may not utilize all the funding, so we are going to be really looking at when we're talking about how housing assistance and the deposits and things like that, how we can utilize as much of this as we can and utilize this money first. But there may be a chance where some of the money may be left over. So the housing teams continue to work on identifying those. So what you'll see in our annual update is this information. These are the areas that we're looking at expending those monies in. We're leaving abroad, not being super specific because we want to make sure that we're able to utilize that money as much as possible for deposits, moving costs, and then, like we said, some welcome bags or boxes that would provide basically home essentials. Things again, some hygiene, some house cleaning supplies, and again, some dry goods, non-perishables that until the person can start to obtain their own groceries. There were a couple of ideas that were floated to us, which included training of various trainings. And so we looked at those, and those were actually some things our housing team thought would be really useful as well, to continue to do training, train up, various, whether they're advocates, individuals at risk of homelessness, housing programs, things of that sort. However, when we went back and looked at what is allowable as a housing assistance, and that's what these particular funds had to be spent specifically on housing assistance. The way housing assistance was defined was, deposits, food, things like that. Training is actually not one of the approved expenditures based on the info notice that we looked at, and we did have several meetings on this as we researched it. And so for right now, with the one-time housing funds, we're not going to be able to do training as some people had suggested. And that's just because that's just not an approved expenditure with these funds. So we're going to hopefully try to get more of that money spent on deposits, move-in costs, and things like that, again, to make sure that they're going as much as possible to the individuals who can benefit most from them. So that's just an update on the housing. You guys will see that that is something new. That is something that we had to include in our plan in order for our team to be, and the county to be able to utilize those funds, those one-time funds. The second thing that we had touched on in those community planning process, and I want to do some follow-up, is that we had talked about sunsetting several programs that had not been implemented. So we had stressed that before. These are not new programs. These are not programs that are in existence. They're not programs that are contracted. Nobody is actually being served directly by these programs. These were programs that were written into our old MHSA 3-year plan, and even in this most recent MHSA 3-year plan, but just were not brought to fruition, either because some of it may have been duplication, some of it is other programs and resources we're using to address that, and also looking at the financial viability of these programs and also sustainability. So we can do the program for a year, but what happens in 3 years from now or 2 years from now? And so if you recall, we had talked about removing the ACT team, Assertive Community Treatment Team, from the plan. Not that we won't be providing those services, but we're not going to set up an additional ACT team just to do that. So we're going to be leveraging some of our existing resources to support that high intensity population, but also utilizing some existing sources to support things like Laura's Law. And so we're looking at if we're going to be having those initiatives and work going on with an ACT team on top of that, be something that could be repetitive or redundant. And then also, again, just from the sustainability. The other one that we had talked about in our community planning forum of sunsetting was integrated wellness activities. And that was just because in, I think, 3 years, that project and program and resources had not been used. So with MHSA, we can't just move it. So we're going to write it out of the plan. We're going to eliminate that. And the funding that will be saved from that integrated wellness activities, which is not large, will be then shifted and utilized in some of our other programs that have a greater demand. We had attempted a continuum of care for youth affected by human trafficking. That was in the previous MHSA 3-year plan. We had conducted an RFP process, and through that RFP process, a contract was not awarded. The project was left in the new 3-year plan just to see if that could be something viable. And then we experienced COVID, but also in the time since this was envisioned to now, we've had a lot of changes in terms of resources and services. And again, we didn't want to create something that could not be sustained, and are going to really look at leveraging existing resources and services to support that. So those are no change. Those are we mentioned to you guys in that in our initial community planning forum. Those are still the same. You'll see those kind of as deletions. So they won't even be sunset because they were never active programs. So they're going to be deletions. We did have a innovation plan initiative that we had started about 2 years ago. It was part of our innovation community planning plan. And one of those things was to look at a youth-led, youth-focused innovation plan. So it'd be for youth, by youth, developed with youth input. We had contracted with San Diego State University to do some work on a project that was called Be Health. And that project initially was supposed to take 6 months, get done, and hopefully have several viable innovation ideas that are for youth, developed by youth, to serve youth. COVID came and it shut down schools. It really made it difficult. And so that project took 1.5 years instead of 6 months. And through that process, we wanted to really look at a youth program or some ideas. We ended up with only one. It was had some good ideas in there, but when we reviewed that particular proposal, it did not meet both MHSA as well as innovation criteria. It had some good ideas, so there's aspects of it that we definitely want to take. And then we took the proposal, some of the information, and actually shared it with the California Pan-Ethnic Health Network that actually was doing some work around Medi-Cal managed care plans and services. And so what was proposed by the youth was something that we thought could really be an interesting area for the managed care plan set. So we have shared that information with them, hoping that they can get it out there, and that might be something that is pursued there. But what we're going to do now is, as if you go to our FresnoMHSA.com, you'll find the annual updates for our existing innovation plans that are live. And under the community planning process, you'll see some of the initiatives that we're working on. And this was one of the ones, this Be Health was one of the ones that was involved in that. And so we're still committed to having an innovation plan or ideas that we can develop for youth that come from youth to serve other youth. And so we have set aside money. We're going to continue to try to engage youth to come up with some viable ideas for a youth-led innovation plan. So not that we're not doing it, we're just not doing this particular one. And we'll provide the report on what our justifications are. But there were some specific things that we just felt made it good idea, but wasn't going to really align with innovation in MHSA. And then the last one was we do have a diversion program funded in part by MHSA that is a part of Assembly Bill 1810, which was diversion programs. And so that's a program that we've had for a few years. It does utilize MHSA for part of its funding. And so when the program staff have been reviewing and our staff analysts have been reviewing the program, they've seen that there's parts of the project that are underutilized, which were in the outreach and engagement and some of those components. But yet there's been a real large utilization and need for the more intensive cases, individuals that need maybe more an FSP or an ACT level. And so what we're going to be proposing in the new annual update is to keep within that program, shift some of the dollars that have not been utilized for the outreach components and some of the lower level services, and really shift those to where the need is in that particular program, which is for more of the high intensity, more that are going to be in need of some greater supports to really meet where the demand is. And so that is not going to be a change to the addition to the program. It'll just be a change within the program. And we did want to call that out within the plan and make sure that that is going to be something that is addressed. So you'll see that. We will be looking at several more PEI programs in terms of how we can really streamline those programs and make sure that they're effective. Several of those are actually county operated and internal programs. So we're looking at, could those programs be funded with other monies versus MHSA, in that MHSA was intended to be the funding of last resort. And so if there's other opportunities for us to fund these programs, we would like to do that and potentially then save some of those MHSA PEI dollars to utilize in other aspects of PEI for other programs or potentially future growth. So we're looking at those. We're looking at what are the ways that they can be more efficient, effective, what are the needs, and those are things that we want to do so that in the coming year, as we start to plan for our new 3-year MHSA plan, we'll have some better ideas of, hey, could we move this out of the plan, not eliminate the program, but move it out and have it be funded some other way. And again, freeing up MHSA dollars to really close the gap and address those things that cannot be paid for or covered through some of our other systems. And then we're continuing to monitor and learn about the impact of CalAIM, the payment reform, and how that may also help some of our programs and or help address some of the gaps in our service, again, to where the MHSA dollars or some of our resources can be allocated to new programs or where there may be other gaps in our system. Going back to the beginning of the meeting, we hope to have a MHSA annual update in January, available for 30-day review and public comment. After that, have a hearing, hopefully sometime in February, get a plan to the Board of Supervisors for approval and allow our programs and the ones that are needing a spending authority, the authorization they need to utilize some of those funds to make some changes, but also getting this plan approved and out to the state, the various state agencies. That allows us to start shifting our focus on the development of the new MHSA 3-year plan, and really want to have something like we did several years ago before COVID, where we did have over 21 in-person forums. I think we had over 700 surveys. We had over 20 key informant interviews. we had a couple of virtual sessions, and we really got great community input and discussion. And so we want to make sure that we do that. And so more time we can plan for, especially around some of the limitations we had with COVID on how we can be smarter and wiser with this, making sure that we're maybe able to do things earlier in the year where the weather may be better and we can do things outside so we can have potentially in-person gatherings. Those are all things that we want to be able to focus on. And so that's why we do want to get this particular annual update completed. Trying to see if there's anything else in my notes. I think that's it for right now in terms of our follow-up session. Like I said, with the exception of the update with how those one-time housing funds can be done and what we're going to be proposing in our plan doing with it, that would be something that's different from our community forum. And I want to say, looking at utilizing some of the outreach dollars for the diversion to utilize it to support the more intensive. I do want to do a follow-up real quick, and which will cover more, I think, in our Hmong session, but we do hear back from our community members that we're looking for some specific services or expansion, really. I want to say more expansion and enhancement of some of the current services that are provided to our elderly Hmong community members who have language barrier as a barrier to access care and some of the resources. And that was something that, a lot of the community wanted, was interested in supports. And so we do have some projects. There's some other state funded projects around the Hmong Helping Hand. So we hope to continue having that conversation with the community and really start looking at what might be some options in the new MHSA 3-year plan. But in this current one, we're not expanding or adding any programs, like I said, with the exception of that one-time housing dollars that we have to fund. And we're going to delete 3 programs that just have not been utilized or ever come to fruition as a way to save some money and be able to utilize then some of those dollars maybe in supporting other programs or needs in our community. Aaron and team, do you guys know if there's any questions in the chats in either the Facebook or the YouTube chats yet?
We have a tiny bit of a delay, but there's no questions on either chat.
So during that time, I'm going to remind everyone, if you have questions, if you have comments, if you have any kind of a need, please email us. You can email us at MHSA. So it's just going to be the letters MHSA at Fresno County CA altogether.gov. And if you email us, we will be able to respond. If your email comes in something other than English, you can still email us in your language. We will work to get that translated and so that we can provide a response to you. So your email does not have to come to us in English. It can come to us in your preferred language. Like I said, we'll translate that, get that information to our team and be able to provide a response. And also any comments that we receive through the email, we'll be able to include in our annual update along with the response. And so getting an email really helps us make sure that we document, any questions that you all may have. So if you're watching this after this live stream and it's on a replay and you're like, but I have a question, send it to the email. Don't post it in the chat, in the YouTube or Facebook chats, just because we don't want it to get missed if we're not checking. If you send the email, it ensures that we do get it and can look at it. And again, you can go to FresnoMHSA.com and you can find more information on, like I said, some of the annual updates for our innovation plans, the current MHSA 3-year plan. So you can look through that and see, when we talked about what are the deletions and what we're, what are some of the changes we're making, you'll be able to get some basis for that. And then there's, again, additional information on that page about the different components of MHSA. We do hope to get this plan done, get it done in a timely manner, and then start working with our community again to start a new MHSA 3-year planning process. And really, this will be, I think, a different process with COVID and just the impacts it's had, but just a lot of other things that we've had in the past couple of years. So this will hopefully with this new plan, we can develop some strategies. But for right now, for the annual update, it's again going to be very minimal changes to that. Any questions yet in the chat, guys?
No.
All right. Well, on behalf of the Department of Behavioral Health and our staff and team working on MHSA services and programs, I want to say thank you. please do not hesitate to reach out to us, email us, mhsa@fresnocountyca.gov. We'll do our best to answer it. But we're going to go ahead and wrap up this one. Hopefully you'll have a great Friday, great weekend. We do have one coming up shortly this afternoon in Spanish, and there is one slated for Hmong next weekend. You can find all those information and the links both on our MHSA page, so FresnoMHSA.com, and also on our social media. Thank you.